Okay, hi, good morning. Today we're going to go over renal anatomy with this model showing a coronal section of the kidney, and then each of the subsequent models are showing more in detail. For instance, this is this and then blown up, and then one of these, a glomeruli, is shown. So we're going to go through each of those. So starting out with this large coronal section, this is actually a larger than life depiction. A kidney is about the size of your fist, so it's much larger than normally would be. But a slice through the kidney, the outer portion of the kidney would be the cortex. The inner darker portion is the medulla. There's a capsule, the very outer portion of the kidney is called the capsule. Medially, the kidney has a sort of indentation here where the major blood vessels and the ureter either go in or go out, and this indentation is called the hilum. So you're in the hilum. Each kidney has a single renal artery and a single renal vein. Going through the branches of the renal artery, immediately as it gets into the parenchyma of the kidney, these are called the segmental branches. And then as the segmental branches go between into the medulla, these are called interlobar arteries. And we'll come back to those shortly. Within the medulla, there's a series of triangular shaped structures or pyramidal shaped structures, and these are called the renal pyramids. Okay. Between the pyramids, there's some lighter tannish tissue here. These are called the renal columns. So renal column, renal column, renal column, renal pyramids. At the end of each pyramid is what's called a papilla, where when urine is formed, the urine will drain out from the papilla into a structure called a minor calyx. Where two or more minor calyces come together, then that becomes known as a major calyx. Here, major calyx, major calyx. And then when all those come together, this would be called the pelvis, the renal pelvis, a trumpet-shaped structure then leading into the ureter, which will then drain into the bladder. Okay. Now, going over, taking, again, if you can think of taking this pyramid and then going into more detail, and going back to the vascular anatomy. So this would be an interlobar artery going between the pyramids through the medulla. And then coming across the top of the pyramids, arching across, is an arcuate artery. And then off the arcuate artery are these interlobular arteries coming up like this. Almost looks like a tree there. Okay, interlobular. Now off of the interlobular then come the afferent arteriole, which goes into the glomerulus, and then the efferent coming out. So AGE, afferent, glomerulus, efferent. And then the efferent in this area in the cortex are known as the peritubular capillaries. When an efferent arteriole goes down into the medulla, these would be called the vasa recta, and these are a capillary network. Okay. Now I didn't mention the veins, but the veins correspond with, so this would be an arcuate vein here. Now the collecting structure, the renal tubule, starts with the Bowman's capsule, and then it twists and turns, and this is called the proximal convoluted tubule, and then goes down the descending limb of loop of Henle, makes a hairpin turn, the ascending limb of the loop of Henle, distal convoluted tubule, collecting duct. And then many collecting ducts come together and drain into what's known as the papillary duct, which is at the end of the papilla, which will then drain into a minor calyx. Now, taking the glomerulus and into more detail, and the term nephron you should be familiar with. A nephron is the glomerulus and then the tubular structure associated with it. So each kidney had millions and millions of nephrons. Now, where the glomerulus and the renal capsule, Bowman's capsule, meet, okay, that's called the renal corpuscle. Now, if we look at that in more detail, you come over here. So this is the glomerulus here. This would be the afferent arteriole coming in, efferent coming out. The glomerulus is basically a ball of capillaries. And what the model is showing, where I'm pointing here, is the just the glomerular capillaries, which would be a one-layer simple squamous endothelium. They are covered by cells called podocytes of the Bowman's capsule, which make up the visceral layer of Bowman's capsule, these yellow cells, podocytes. Now there's a space, this is called the Bowman space here, where the filtrate will start to form. And then this is the outer layer or parietal layer of Bowman's capsule. And then this would be the beginning of the proximal convoluted tubule. Now, also seen here, where the afferent arteriole is coming into the glomerulus, it's in close proximity to a portion of the ascending limb of the loop of Henle, specifically called the macula densa. These cells in the ascending limb are called the macula densa, and the corresponding cells in the afferent arteriole are called the juxtaglomerular cells. And they have an important role in what's called tubuloglomerular feedback to maintain glomerular filtration rate at a steady level. And I think that's it. Thank you.